The fight against South Africa's second leading killer disease, tuberculosis, will receive much-needed a boost as BRICS health experts commit to working together to end TB. This came out of the recently concluded BRICS TB Research Network Innovation Summit in Durban. The health department says while the infections have gone down significantly, it remains concerned about the high number of TB fatalities. According to the United Nations, TB claimed the lives of more than 54,000 in the country last year. Head of TB programs at the Health Department, Professor Norbert Ndjeka, joins me now to chat more about this. A very good morning to you, Professor. Thank you so much for your time. Perhaps let's take stock of where we're standing as a country in the fight against TB and really taking stock of the number of deaths that have been claimed as a result of tuberculosis. Talk to us about this.
Yeah, thank you so much. Good morning to you and good morning to all the viewers. Thank you for inviting me to speak about tuberculosis. Indeed, we had 4 days of extensive engagement with our colleagues from the BRICS countries. We've been discussing the situation of tuberculosis. As a country, we stand at a point where we have approximately 280,000 people who get active tuberculosis per year in South Africa. That was the estimation for last year. And we diagnosed and put on treatment 214,294, which is 77% of what we should have been treating. The incidence is coming down. We really doing more tests now. We're finding more people. We're recovering from the damage caused by COVID. But it's still work in progress. We still have high mortality. We've not seen a big decrease. We moved from 56,000 estimated per year to 52,000, more or less, somewhere there. So it's a small decrease. A lot of people continue to interrupt treatment, and that's where we are, and it's really work in progress.
And as a result, some strong commitments were made to ending TB by health experts, including yourself at the summit. What were some areas of importance insofar as innovation and collaboration is concerned in addressing the substantial impact of tuberculosis within the different nations?
So we had a robust debate, really, to look at program implementation in the BRICS countries. We also looked at TB vaccines research. We looked at TB diagnostics and prevention. So in terms of program implementation, we're very happy to hear a lot of innovative interventions in the various countries. We had a lot of social interventions in India, community-based social. We thought we all enjoyed those lessons on taking care of people, taking care of communities. We've had some fresh science on TB vaccines from South Africa. One of the speakers spoke about delivering straight into the lungs as a new idea, which we've not really had before. And we also had there's a vaccine in China that is being developed. We've heard a lot is being done to prevent TB in terms of primary prevention, but mostly TB preventive therapy in terms of the medicines to be used to make sure that latent TB is treated, then it doesn't become active TB. We really took cognizance of the fact that just BRICS, Brazil, Russia, India, China, South Africa alone, we have 38% of global TB, and we're committed to work together in terms of program TB vaccines, but also developing new tools for diagnostics and working together around the vaccine area. So these are some of the deliberations we had.
So what will it take to ensure that the collaboration is indeed effective as you perhaps, look at some of the other challenges that you're facing as nations, a lack of new diagnostics being one of them, as well as medicines and the vaccines required. I mean, you make mention of new ideas around vaccination with China, but for the collaboration to work and be effective, what do you think it will take?
So what it will take really is close collaboration among the countries, and this really has been historical. We never met in this fashion before. The network existed from 2017, but this is the first time that TB program officials, senior officials from Minnesota and the researchers, TB researchers, were meeting in one room. And it really opened our eyes. We felt that we need close collaboration. We need to exchange more of our science. We need to identify a few projects that we should work on, like the 2 vaccines idea, the one from Cape Town, the one from China. We need to put those scientists together and work together and see whether the 2 vaccines can really be pursued, and then we get them into our hospitals or facilities. But more important, we need resources. So we had a group of people who are going to work on, who are starting to reflect on resource mobilization. We need resources. We want our governments to fund these initiatives in terms of research, in terms of what we need to do, for example, exchange. And Russia will take the presidency next year, and this is something they want to pursue as well. But the WHO, the World Health Organization, was in the room supporting us as well as a neutral body. So it was really refreshing. Want to work together, want to bring more resources, but more important, agree on what are the projects that we're going to be working together. We are the young scientist from South Africa, who's based in America, who's developed a test, a TB diagnostic test with the Indian colleague. And we thought it was also brilliant to look at young scientist idea, because success story must have successors, and young people must not be left. They also have ideas. So we really enjoyed all those ideas during the meeting.
So what came out of the agreements, or perhaps the agreements on strengthening transnational cooperation to finance and conducting the research that will be needed to transition the economic bloc from being consumers to now suppliers of affordable and accessible tools required to fight the disease?
Yeah, so what we noted is that the areas of collaboration within BRICS include more than tuberculosis. Therefore, we need to now escalate our ideas to, for example, the BRICS vaccination network, because there is a body that is looking at vaccines, not just TB vaccines. So we will escalate to these structures that already exist that look at all issues within the BRICS. For example, we know that there is a forum of regulators. We do have our South African Health Product Regulatory Authority, but they have a meeting, a forum with other regulators, other regulatory authorities. So we will escalate these things to them so that as they make broader policies, they should factor tuberculosis, because it is really a bigger problem. So that's really one thing we want to do. But through our declaration, we want to also promote the implementation of decisions from the Ministers of Health meeting. Want to promote a BRICS journal, a scientific journal, medical journal, and exchange of staff around, so that we get to know one another. So these are some of the things that we are going to be doing, but it is a work in progress. We also welcome the invitation by the World Health Organization to bring us all next year to Geneva and have one conversation. So these are all the interventions that are going to be put in place.
With all those innovations that have been brainstormed and the big ideas that have come from the summit, how does it then work with the health department here at home, especially considering some of the budgetary cuts and the fight against tuberculosis? How does the information now work to the advantage of South Africa's issue with tuberculosis and, of course, fighting and reducing the numbers of those infected and those who may not be taking treatment but should?
Yeah, so in South Africa, we've developed a TB recovery plan, which we update every year. We're really trying to improve communication. We're working very hard to create demand for TB testing in the country, create demand for retention in care. We've changed our policy in terms of case finding. We test high-risk groups regardless of symptoms, something that other countries are not really doing. But our TB prevalence survey showed that there are people who don't have symptoms yet they have TB. Now, when you do digital chest X-rays and various other things, you can find that they have tuberculosis. We picked up there are such people among us. So we also send SMSs to everybody that get tested for TB. And I would like to appeal to all our people out there to give the correct cell phone numbers when they go to healthcare facilities, because then we can reach them. At this stage, not everyone provides correct cell phone numbers. If we do that, we're able to link everyone to care, and we want to retain all our patients to care. We're shortening treatment regimens. Our MDR, which was a 2-year treatment, we now treat all eligible patients, which make like 90% plus of our cohort. They start to get 6 months regimen for MDR, multi-drug resistant tuberculosis. So these are really game changers that we have put in locally. We're also working on the TB vaccine. Research on TB vaccine is advanced in South Africa. So we really look forward to all this, including improvement of our data systems, because if you don't have good data systems, again, we had India as a real-time data system, very interesting. So we're sharing. They were impressed with our shortening of MDR regimen to 6 months. We're impressed with their community interventions, the effort in China to identify people, small communities that are really driving TB numbers down and reward them, give them certificates. So these are all ideas that we're really putting in place, and our recovery plan year in, year out is helping us, number one, to decrease incidence, improve case finding, and we believe that moving forward we shall decrease death rate, which is still high. We shall decrease loss to follow-up and improve overall favorable outcomes for our TB patients in South Africa.
Yeah, very well. Thank you so much for that. Head of TB programs at the Health Department, Professor Norbert Ndjeka, giving us a sense of some of the deliberations that came out as BRICS health experts came under one roof to talk about plans and innovations in the fight against tuberculosis.